We've been traveling to Porgera in Papua New Guinea for the past about 5 years. Originally, we were looking for a mission outreach opportunity that was somewhat in our backyard here in Hawaii, and we looked into the Pacific, and we were struggling with finding a location where we could be of service. And I talked with Dr. Richard Hart at Loma Linda University, and he had this connection with this tiny little hospital way up in the highlands of New Guinea that had no resources really to speak of, very limited resources. And he put us in touch with Dr. Moises Granada, who's been at the hospital for some time. I think he's been there now almost 15 years. And prior to that was in Africa serving there. He's a lifelong missionary doctor. And he put us in touch with Dr. Granada to see if we could be of service there in Porgera. Porgera is a fascinating place. It's in the very far reaches of the western highlands of New Guinea. New Guinea is an island nation north of Australia in the tropical area. And it takes us about 3 days to get to the hospital and 3 days to get back. So it's really quite a rigorous journey to get there. The roads are bad. We go through a 5 to 6 hour bumpy ride from Mount Hagen up to the hospital way up in the highlands each time that we go there. And that's really part of understanding the remoteness of the area, I think. Dr. Naden and I initially went on a very short reconnaissance trip to Porgera and experienced the difficulty of getting there, and then had the opportunity to really look at what their issues were and what their needs were. And we came away just absolutely inspired to go back and to try and help this little facility and to do some good there.
This is a fairly large rural community of New Guinea people. Approximately 60,000 to 80,000 people that this hospital serves. It's close to the gold mine up the hill that we know about, which is what's brought many of these people here. They don't have other healthcare services available to them. And so this hospital is really it. It provides outpatient clinic services and inpatient services when necessary. Most of those things that are provided are surgical services because those are the specialties of the physicians who are here.
We've traveled now to Porgera 4 different times, and each time we've taken a very similar team. As it turns out, unbeknownst to us, the most important need has been for vision care. And of course, Dr. Naden was with us, but they have no vision care there at all. So we've taken a team that's included people who are good with technology and equipment, people who are good in the operating room, nurses, therapists who can help with the inpatient care, which is different than the vision care. And of course, I'm a nurse originally and still proud of that heritage that I have. So we've taken a small group, but really our primary focus over the years has been on vision care.
We've been trying to help the patients in any way we can, and I was doing therapy with them. And what I love about them is that there's no whining. There's no trying to get the person, trying to talk them into doing some therapy, getting up. They're willing and they work so hard. And now these people don't have pain medication or very little, and they never complain. And they work so hard in this, in a hard environment.
I'm an internist, so I've come here to look at internal medicine questions, internal medicine problems, patients in the hospital who are having interesting issues that can't be settled and solved simply. I don't do surgery, and so I'm really looking at sort of system issues related to medical delivery.
There are a lot of people here that come with eye injuries that are related to somewhat the violence of this community. We don't see a lot of older people, surprisingly. Most medical mission work I've done, we see a lot of older people with cataracts. And here we certainly see some of them. Largely these are younger people, middle-aged people, and we think that's partly because they just simply don't live long enough here to reach old age and develop cataracts. Most of what we've seen the trip this time have been people in the middle age who aren't able to see up close any longer, and they can't do their sewing and they can't do the close work that they need to do to keep their families going. A lot of people come complaining of burning, irritated eyes, and they're red and inflamed and dry, and that partly is related to the fact that they cook inside their homes with no chimneys. There's lots of smoke and they're exposed to a lot of smoke day in and day out, which causes a considerable amount of eye irritation.
Because we're putting so many people through, we saw 510 people in basically 4 days of clinic, which is really remarkable that Dr. Narden and the team were able to get so many people through. We didn't get a chance to talk to everyone, but there was one gentleman, for example, who we gave some glasses to. I think he was probably in his 60s. And he said that he came back later and said he was able to see the mine, which is, we could all see obviously from the hospital. You can see this, the large barrack mine, which is on the other side of the valley, but he was so excited that he could see the mine.
People have never had access to eye care services before, most of them. A few of them we've seen have been to eye doctors, hundreds of miles away from another town, but largely they've never had eye care services before. And so it's been a lot of fun and really interesting to be able to provide them with a pair of glasses or occasional cataract surgery or repair a wound that's debilitating for them. And they're just massive numbers of people that show up for different things, largely eye irritation, largely vision issues that they've never had access to care for. We've brought along with us hundreds and hundreds of pairs of glasses, as you know, and dispensed most of those hundreds of pairs of glasses, and most people leave smiling and pleased that they can see a little bit better.
Unlike our hospitals here in America, the hospital in Polgara has very limited access to resources. We've been astonished by the lack of simple availability of simple items such as gloves, syringes and needles, sheets for the beds, soap, things that we would just take for granted, and every time we see something new that is just so sadly lacking, their ability to budget is very limited, clearly, by the resources that they have available. And so they need help from lots of outside agencies to be able to just provide day-to-day care.
A lot of the equipment they have is 15 to 20 years old. The parts are non-existent to order. The manufacturers have been bought out or not even existing anymore. So the requests for parts were really hard to come by. Castle was fortunate enough to be able to send replacement equipment versus trying to even fix the equipment that's so old. So that helped out in a lot of ways for them. We've noticed in the last few trips that there's not a whole lot of emphasis on hygiene. Chris, Simon, and myself had a plan. We bought 50 bars of soap, and we would take the patients as they were sitting in line down to wash their hands, show them and educate them on how to do it. And the smiles on their faces as they were doing it was just so rewarding. They would come back, they would hold their hands up as if they were scrubbed in as doctors. And why we did this was really for showing them, educating them on it. We actually gave bars of soap away after that so that they can continue to do that. And I think it had a really huge impact.
We're so appreciative for all of the people who have stepped up and donated things, simple things like their old eyeglasses that they don't use anymore. Or we've got one associate, her name is Tony, and I believe she handmade 30 hats. Each hat took her an hour to make, and we took those and gave those to these people, and they're so appreciative. And we in turn are so appreciative for the people who donate so many things that don't seem consequential, but they really have a big impact at the other end where they're put into use.
This is an amazing experience for those of us who practice medicine in the United States with all the amenities and the technical abilities to investigate problems and do laboratory tests and radiology tests and pathology tests on the spur of the moment. These are people who really have very limited ability to do these things, and it takes us back to the days when your physical exam and your history taking was really the best you could do to help a patient figure out what was going on. So for me, it's been very eye-opening to understand how these people can practice with all the things that I don't think I could practice without anymore.
It's more than rewarding. It's really changed my life. In fact, actually they give more to me probably than I give to them, because they show me incredible strength.
You know, as I look back on my 4 trips to Porgera, I just feel so incredibly blessed to have gotten to know these wonderful people. I consider them my ohana, my family. One of the biggest compliments I think I've had was on this last trip, where Simon, who's one of the hospital workers there and someone we've gotten very close to, said to me, "Kathy, you're like another mother to me." And that's the kind of relationships we want. We want them to know that we love them, that we care for them, and that we'll be there for them to help provide for their needs and the needs of the patients that they serve in that very remote community. So yes, it's a love relationship. We love the people there, and we want to share some of the bounty that we have with them so that they can have a better life.